Thank you, Liz. Got it. Because we have interesting stuff and we'll get started. So welcome everyone. I'm Farla Kaufman, chair of PHAB, thinking about changing the pronunciation of our name, which was suggested by somebody recently, to FAB instead of PHAB. So we can talk about that later. But welcome to our monthly board meeting. We have two really great speakers today, and we'll get to them as soon as we deal with some business. One of them is the approval of December meeting minutes. And since we have a quorum, I'd like to do that now. So I hope you've had a chance to read over the minutes from December. Are there any edits or changes to them that we have to make? Nope. Well, good. So do I have a motion to for approval of the minutes?
Motion.
Thank you, Jeffel. Do I have a second? I think that was key.
Second. Right.
Great, thank you. So we vote in the chat as always, so please let me know by entering yes or no or aye or nay into the chat about approval of the meeting minutes for December. Okay. I'm just tallying the vote here. Okay, I think we have majority of ayes. So minutes accepted, and let's move on. So I just want to let you know the PHAB and vacancies. Currently we have 4 vacancies that we're trying to fill. We have incredible members on the board. We'd like a few more. So if you know anybody, please let us know. And that's all we have there. I want to acknowledge again that Tina Slee has resigned from the board, and she was amazing for all her service, and we wish her well. And so Sonal is now vice chair, as you know from the last vote, last meeting, and appreciate her stepping up into that position. Anyway, so now we have a public health advisory, public health division update. If I'm not sure if I don't see Olivia on yet, so I'm going to switch over. I know Sandy's here, so we'll do the primary health division update first. Thank you again for sending us those wonderful notes, and I think Liz will bring them up as you give us an update.
Okay, good afternoon, everyone. This is Sandy Damiano, and I have kind of an unstable internet connection. So if I disappear, I will call in to that. I was focused on COVID, as most people are, as the Omicron virus is going on. So I wanted to kind of just do a COVID update again, and Liz has it on screen. For our juvenile correctional health, this is the period of Christmas week. We've had a total of confirmed cases throughout the pandemic of 63. For those not familiar with the youth detention facility, it's rather spacious. So there's a lot of space in there, and they have a very, very excellent facility. There were no new cases that week. I'm anticipating for the next report, we will have cases as new cases are coming in with the COVID. The census as of Monday was 115. The vaccination they've done to date is 102. They do have to get parental consent for the minors, and they do have an incentive program that began in mid-July. Staff are finding it's harder to entice people even with the incentive program and with education. So they're trying to figure out what else can they do to incentivize residents. For adult correctional health, we This is the week of December 29th, our dashboard. You can see that we did 505 tests that week, and that we had 3 new cases that particular week. Our dashboard that's coming up from the next period, which we're going to report out on today, will be a lot different. We're seeing a lot more cases coming in through the intake booking loop with the Omicron. So this was the quiet before the storm on this particular dashboard. And at that time, we only had 3 confirmed cases at the main jail and 0 at the branch jail, which is excellent. We've had a total of 2 COVID-related deaths throughout the entire pandemic, and we have reported those. One of the deaths was an out-of-custody person that was transferred to the hospital and released with a couple of weeks remaining on his sentence. For the outbreak, I reported, I think, on last couple of times. That occurred the week of October 18th. This was with the Delta variant. It was resolved rather quickly at the main jail in early November, and it was resolved at the branch jail. We had our last case, I think, on December 10th. So staff really identified and intervened on the outbreak. So it was a much shorter duration and far less cases than the first time. The medical staff were commended by the state public health outbreak team. We did do consultations with them, and they felt we did the best we could, particularly in light of the facilities and how they're configured. This morning, just to give you a comparison, we had 3,500 people in the jails. So we're really at pre-pandemic levels, which makes our COVID housing, our designated housing for intakes or close contact, suspect or isolation, very, very tight because we're having so much space go to that. For the inmate vaccinations, we do an incentive program. And if you look at the top of page 2, we have vaccinated 2,684 inmates. And we started giving booster shots to anyone that also wants the booster dose, and we are encouraging boosters for the inmates. When you look at a point in time, despite all of these vaccinations, it's probably about 30% of the census is vaccinated. That's just because of the high churn rate. Typically, we'll have about 55% of the population leave within 3 days. So we have a very short population, and then we have a longer term population in the jail. And then right before Christmas, the state public health put out a series of orders. They amended the order for correctional facility staff for workers. And it's in effect now with full compliance by February 1st. It is mandating booster vaccinations for staff. For the health department staff that work in the jails, we treat anybody working in the jails must be vaccinated from a health perspective. The sheriff has their own procedure for that. They have a more narrow definition of the vaccination. We've had very good rates of vaccination, from 90 to 97% staff vaccinated, which you can see on our data. But we will be now having to show the proof of the boosters. So I think we'll be starting that process this week. And for people that are either exempt, have an approved exemption, or are booster eligible but have not received a booster, they are required to do weekly testing. So that is a big event for us and is pretty time consuming. In addition to our inmate testing of COVID, which you saw, we did 505 tests that particular week. For the staffing test, public health conducted another 400 tests just for staff that were exempt or unvaccinated, and for inmate workers. Most of these are sheriff's employees. as well as inmate workers, as you can see by the chart. I'm expecting the numbers in there to increase until we have our medical staff all get boosted. And that's pretty much it on COVID. For the vacancy report, you were interested in that, so I just put our latest figures in there. We are very short-staffed with nursing, medical, and mental health. So it does interfere with our service access provisions and all of our requirements. Staff are trying their best to get all of those positions filled. I went over a lot of information quickly, so I don't know if anyone has any questions.
Sandy, I do. Thank you so much. There's a lot of information there. Appreciate all of it. So in the vacancies in the medical category, could you give us an idea of what classifications? Are they mostly nurses?
I could probably, I have to find it. It's really, there's nursing for different levels of nursing, RNs, LVNs, medical assistants. We have physician positions, and I'm happy to break that down for you. I could probably send it after the meeting. I won't be able to look for it. Anytime,
just an idea. So you mentioned last time or one of the previous meetings that there's negotiations ongoing with the unions.
Oh, okay. So we did complete the one with the physician and dentist, and we completed the registered nurse union. We are missing the one, it's called AFSCME, which has a lot of the different health staff in it, like LVNs, medical assistants, pharmacy, dental, etc. So that one will be, hopefully, this spring. We'll do that.
So the outcome of the completed negotiations, is that going to help in terms of, is there any provision for increased salaries? Is there any good news on these fronts in terms of recruitment?
Yes and no. So we've been able to hire more physicians, but it's very slow. A lot of physicians do not want to work full-time, particularly in our setting. For nurses, part of the economic package takes effect this month, and I don't know exactly what day. So until we get that package complete, we're going to have to assess the hiring for that. We've also, as we've been hiring, we have been having a lot of retirements of long-term staff. We have so much change within the jails trying to do these remedial plan requirements for the consent decree. It's a lot of pressure on the staff. Some are deciding to depart instead. We're also hearing that with our mental health staff, and I'm happy to give more of an update on those consent decree requirements, either the working group or the PHAB, depending on what you want. But we are, in terms of gaining staff, we gain staff, and then we're losing them because of these retirements and other things that are going on. So it's very hard to get the traction going that we need.
Wow. Oh, well. Needless to say, let us know if there's anything that we can do in support of that recruitment and retention effort. Thank you. Any other questions for Dr. Damiano?
Thanks, Dr. Damiano. This is Libby. And I just wanted to go back to something. You gave an update on sort of definitions of vaccination between the health staff and the sheriff's staff. You said that their definition was more narrow. Is that for who's eligible or what compliance looks like? It'd be great to just hear a little bit more about that, the details of how they're operationalizing the mandate.
Okay, so if you look at the mandate, which I could also give a link to Farla on as well after the meeting, but if you look at it, how I interpreted it is very broadly. And so what I've said is any of our staff, adult correctional health or contracted mental health, even administrative staff that work in the jail, they're all required to be vaccinated. And then there are some of us that work off-site. We are also required to be vaccinated if we go on site periodically. So I have a pretty, inclusive process. Everyone must be vaccinated. For the sheriff's department, they've interpreted as those deputies or officers that work within the health areas. So it's a narrower definition.
I see.
And then,
Thank you.
And then, of course, all inmate workers are required to have the vaccination or be tested. So you can see on the one chart where we are vaccinating inmate workers, and then there are workers that are also refusing vaccination. So those are the ones getting tested. And I'll send that link to the public health order along with some more staffing details to far left.
That would be great. Thank you so much.
You're welcome. Any other questions?
I have a quick question. This is Steve Orkhand. And the question has to do with the reasons behind the refusals for vaccination amongst the inmates. You mentioned that there were some educational efforts there, but I'm curious if you're finding that there are consistent reasons why people are not agreeing to the vaccination and what can be done about that.
Yeah, it's really, really hard. And for anyone who's worked in a correctional facility, you'll find you'll get more refusals overall to anything, whether it is a flu shot, STI testing, anything, you'll get more refusals. So it takes more efforts. I think early on in the pandemic, what people were seeing, particularly in the jails, because there are these young men, you would see a lot of cases in the jail, a lot of asymptomatic cases, which is what we saw during our initial part of the pandemic. Once we had the Delta, you started seeing a few more symptomatic cases. So a lot of people were saying, oh, it's not bad, kind of, it's just the flu, it's just the cold. We've also had rumor control where people thought that if they got vaccinated, they would need to go to the prison, and they didn't want to go to the prison. They want to stay in the jail. So there were all those kind of rumors that happened as well. So there's a variety of reasons why they refuse, and others just don't want to do it, even if they're in a high risk category and we have medical staff approach or reapproach them.
Thank you, Sandy. I have one other question having to do with your psychiatric staff. That's all on contract, I know, with UC Davis. And
Yes.
I know there sometimes have to be enhancements of salary, et cetera, to bring people into a jail setting. Are they flexible in that way, or how is that managed?
Yeah, so just for you to know, in terms of the landscape of licensed mental health professionals, there's a shortage overall. So it's not just for the jails. I know I talked to my colleague, Ryan Quist, for the behavioral health. They're having problems just in the regular system. So when you overlay corrections, which is a much harder, much more challenging environment, it's worse. I can tell you our UCD contractors pay good rates. They really do. They are looking at what else can they do, but their rates, the county can't compete with those rates. They're high.
Thanks.
Thank you so much, Sandy. Really appreciate it.
I think you got a public health staff on now.
Where are we? Lenan,
Yeah, thanks, Lynn.
okay. Lenan, are you filling in for Olivia for our public health update?
I was not asked to do that, so I can't say that I'm prepared to do that, but I could
That's fine.
I could forward some things via email if you would like, that you can share with the group.
Sure, and then we'll post it on the website. That's fine. And if Dr. Kasurier joins us after, we'll be able to get to her. Thank you very much.
Okay, all right, thank you.
So right now we'll turn to our next item, which is the presentation from Deborah Payne, who's chair of the Medi-Cal Dental Advisory Committee. I apologize, there was an inaccurate title for the committee on the agenda. It's just the Medi-Cal Dental Advisory Committee. And we are very appreciative of receiving this update from one of our related advisory boards. So welcome, Deborah, and it's your stage now.
Okay, thank you.
Thank you very much, and thank you for pulling up the PowerPoint. It's not a long PowerPoint, so I think I'm less than 10 slides. But I think I can give a pretty good overview of some of the work that we've been doing, and then talk about the work in the future. Can you go to the next slide? Here's our Mcdac membership. We have a diverse membership, really dedicated people. We have the First 5 Sacramento Commission, Department of Health Services, the public health officer when we can get her. She's been quite busy, of course, over this last year and the year prior. We have membership in the Sacramento District Dental Society, the Dental Association, although that seat is empty right now. They're recruiting for another person. We have Head Start beneficiaries, grandparents, community dental clinics. We've just moved that up to 2. We only had 1 being represented before. We have 2 dental providers. We have a family practice doctor. Of course, we have Steve Heath from the Public Health Advisory Board. We always appreciate his participation. We have advocates, members at large, dental plan representatives. As you may know, in Sacramento County, we are managed care dental. So the state has contracted with 3 dental plans. That is Access Dental, Liberty Dental, and Health Net Dental. So all Medi-Cal beneficiaries are assigned to one of those 3 plans, except we do have a small fee-for-service population, many youth and foster care, of course, but it's a much smaller number than the balance of the beneficiaries. We've just added a registered dental hygienist to our board. So next slide is our accomplishments in 2020 and 2021. We've worked with stakeholders on strategies to improve utilization services for all Medi-Cal beneficiaries. And we work on special cases when they are brought to the table. Each of our members may hear of cases that need to be escalated to DHCS or to the dental plans. We try with the dental plans first, and if we can't resolve the issue, then we have DHCS. One of the things about this committee, we were established by law in 2012, and so we're in statute, and one of the items is that we were able to get DHCS to meet with us at least 4 times a year. And that has really made for a lot of progress in issues, to be able to have them at the table. We updated the Mcdac charter to include the additional FQHC member and then added a registered dental hygienist, as I said, sorry. We selected a Mcdac member to fill the Sacramento County Health Authority Commission. And I was selected into that seat. I've been attending all of those meetings, many meetings, given that we're taking a look at the next round of health plans that will be selected to serve Medi-Cal beneficiaries in Sacramento County, starting January 1st, 2024. We established a special needs general anesthesia committee to gather data and recommendations to improve services. A study was funded, actually the Sacramento County Oral Health Program, Prop 56 funds, covered the cost of that study. Very interesting. I've added a link here so that you can take a look at it if you'd like more detail. But given that we're kind of special here in Sacramento County, we really need county-specific data. We have there were 14 recommendations that came from that study, and we formed 3 subcommittees to follow up on those recommendations. So this isn't just the study that gets put on the shelf. We really are working actively to improve things for special needs kids and adults in Sacramento County. We also participated in the Sacramento County Oral Health Strategic Plan and Needs Assessment. We work with Early Smile Sacramento. This is the only school-based oral health assessment program that goes to the schools. Of course, things have been interrupted in 2020, and 2021 continues to be interrupted, but they found very creative ways to be able to do oral health assessments at school lunch pickups and those kinds of strategies. We worked, of course, collaboratively with the DHCS, Sacramento County Public Health, and the Dental Transformation Partners. Dental Transformation Initiative has now ended as of December 2020, unfortunately. DTI had funded 3 strategies. One, virtual dental home, where dental services were brought to children in the schools, where they could have x-rays and exams and referral to the dentist if they needed additional services. If a child was scored a 1 or a 2, then they just maybe needed a dental appointment. But if they were found to be a 3 and really needed care immediately, then the dental clinics that were partnered would see the kids within a day or 2. And then we had, a partnership with the doctors and dentists, where then the the doctors would do an exam, make a referral to the dentist, and we could see whether or not the child had seen the dentist and have that information go back to the doctors, which was lacking prior. We would like to be able to continue that, of course. And then we had some community partnerships where like the Sacramento District Dental Society developed dental focused puppet shows and took those puppet shows into the schools. Those were very well received, and they are still providing those puppet shows. So DTI is very happy to have provided the funding in order to make that happen. And we also developed a wonderful website, which is on the public health page for Sacramento County. If you want to go look at that website, there's all kinds of interactive modules for parents and for providers, and lots of great information. We also monitored the increasing number of Medi-Cal beneficiaries, both children and adults, and to make sure they had timely access to dental care. And we provided regional stakeholders the opportunity to bring dental issues for discussion, problem solving, and action. Next page, this gives us the annual dental visit utilization amongst beneficiaries 0 to 20. And we also show here what Los Angeles County, which is the only other dental managed care in the state, and comparing the numbers also to, or the percentages to the rest of the state, which is fee for service. So fee for service continues to outperform dental managed care. And of course, you can see that in 2020, given COVID, then utilization numbers certainly went down, unfortunately. Next page is sealant utilization amongst kids aged 6 to 14. Of course, they can get a sealant at age 6. And again, comparing to the other service delivery systems, Sacramento County, we are way too low on this number. This is something that we are working on. But there isn't a sealant program in Sacramento County. So this is the providers that are providing sealants for children in Medi-Cal. Then these are the adults numbers. We go to the next, yes. Adults is very low, of course, only 17%, almost 18% of adults are utilizing their dental benefits. Of course, there's a lot of reasons for that. One, when adult dental was stopped, then, getting the word out when the dental benefits resumed takes a long time. And many adults don't even realize that they have dental benefits if they have Medi-Cal. We are going to be turning our focus not away from children, because we'll still work on that, but to adults to help get the messaging out, and also helping them to find services. Many adults, even if they know they have benefits, have a difficult time making an appointment. We really would like to do an adult study like we did for children. And we're in conversation with county leadership to find the best way to gather that information. One possibility is we may fund an adult dental study. We had Barbara Avid, many of you may know her, and she has conducted many of the studies that First 5 Sacramento funded, and then of course DTI conduct that study, but we're in that hasn't happened yet. Should happen early 2022. Of course, we could always come back and then give you a report on what that study finds for adults in Sacramento County. This slide, the next one, if we can go, next one. There we go. So this shows the utilization by provider. So for 2016, 17, 18, 19, 20, you can see each of the dental plans, and Liberty, it always has a little higher performance than the rest of the group, as you can see over the years. Next slide. So we have, of course, many goals for 2022. We'll participate on the Sacramento County Health Authority Commission, of course. And I'm so glad that they have an oral health seat, and so that is where we provide information. It's really important to have the health plans understand that there's responsibility for oral health. If you're going to have a totally healthy person, you also have to have a healthy mouth. And we want to develop partnerships where there's more collaboration between medical providers and the dental providers. If we get the funding, we'll implement and participate in the adult dental study. We'll continue to support projects and policies, especially Early Smiles Sacramento, since they're the only ones in schools currently. We'll let's see, for the next two bullets, I'll mention, some of you may know that last year DHCS in the governor's budget recommended to end dental managed care in Sacramento County. As it turns out, that was stopped, and then the dental plans were continued for another year. It will come up in the governor's budget again this year. I think it is the DHCS's intention to end managed care in Sacramento County. So we will monitor that. If a new contract comes out, then we'll have input to the new managed care contracts. But if dental managed care is not continued in 2022, we will assist with the transition to the fee-for-service delivery system. We'll continue to meet 4 times a year with DHCS. We'll monitor access to general anesthesia and IV sedation. One of the things that has come up, we found a provider who was charging patients $600 cash in order to have IV sedation. We've just learned that that provider is under investigation, and they won't be able to do that anymore. Of course, it's illegal to charge for a covered benefit. So this is just some of the work that we've done in the past years, is monitor that kind of activity. So then, of course, we are very closely aligned with the Sacramento County Oral Health Program, Prop 56, and we provide input to them. So with that, here are our, in the next slide, are our contact information. Jonathan Porteous is the new vice chair, and Jennifer Fitzpatrick is our staff. We're so happy to have her. And here's the contact information, of course. And then I have to read what Toothy says here: brush 2 times a day for 2 minutes each time. And with that, I'm open for questions.
Thank you so much. Are there questions for Deborah?
Deborah, Steve, I'm thinking that we might want to go a little more in depth about the discussions with the state about geographic managed care and dental managed care versus the fee-for-service system. We've had a lot of discussion and not necessarily unanimity on the advisory committee about the position to take on that, worries about disruptions and things like that. Could you get into that a little bit further?
Sure, certainly. Yes, there are some who would like to see us go to fee-for-service, given that fee-for-service outperforms in the rest of the state. There are others that are very concerned that the managed care member services departments would then go away, and it might be difficult for patients to get connected to care. They'd pretty much be on their own for finding a dentist that accepts fee-for-service. Also, we haven't really had a large fee-for-service system in Sacramento County for many years. And so people are concerned, will the managed care dentist then sign up and participate in fee-for-service? And so there could be quite a lot of disruption for Medi-Cal patients trying to get dental care. Steve, is that enough, or do you want to say more? You've been to all the meetings.
That's good. It's interesting that fee-for-service statistically outperforms, although the managed care, although we've had a lot of discussions about whether we're counting apples and oranges at the same time. But it's a potential significant disruption in the delivery system here. The other thing that has struck me and as being part of this committee is the lack of access to operating ORs for patients who need to be go under anesthesia for surgery as opposed to just local anesthetics. Hard to find doctors who will do it, and hard to find hospitals or other sources of ORs that will allow them to do it.
Yes, that's very good. Thank you for mentioning that. The OR space has shrunk over the years, unfortunately. Dental cases is not as profitable as some other things done having to be done in an OR, there are fewer dentists who actually perform this. We only have Dr. Musser, who serves kids now, and then Dr. Bagao, who serves adults. And of course, I'm saying for Medi-Cal. And finding OR space is very limited compared to the need. And particularly around special needs patients, they absolutely have to have their dental work done in an OR. So this is an issue that we're really working on. One of the things that has happened, excuse me, I'll go back. California North State University will be building a new hospital at the old Arco Arena. That's showing my age. I call it Arco. And we have an agreement with them. They will build out a dental dedicated surgery center there. Of course, that's years off. They may begin building this year, but it'll take a few years for that hospital to be completed. But we're very excited to at least have the commitment to build a dental dedicated surgery center so that we're not in conflict with others for the space.
That's great to hear. That's really going to be a major resource, it sounds like it.
It really is, and we are glad to have, go ahead. Did I have a question?
No, actually, we're out of time, but it was great to get this update. If there are other questions, please just put them in the chat and I will forward them to Deborah.
Very good. Thank you, everyone.
Thank you very much. Now we're going to continue on. Rick Heyer, the counsel for Sacramento County, has graciously consented to give us an education on the Brown Act. So please take it away.
Good afternoon, everyone. If we go to the next slide, I'll just start by saying that this is a tough presentation to do in person. The subject matter is not always the most interesting, and certainly Zoom does not help that any. But it really will be better if this is participatory. If you have questions, please don't hesitate and ask while we go through this. I will try to do this pretty quickly, but try to cover all the high points. With that said, the Brown Act is California's open meeting law. Liz, if you could hit the animation there. It is about 70 years old. It was driven by a series of articles in the San Francisco Chronicle back in the early 1950s. The author of those articles and the series that were those articles was titled Your Secret Government. And as that title implies, the author went around to various local meetings or local government meetings in the Bay Area. So city council meetings, board of supervisor meetings, school board meetings. And when he did that, he was routinely met with challenges. And some of those challenges were that, well, one, he couldn't even find where the meetings were going to be held, what time they were going to start, what was going to be on the agenda. If he could find a meeting and he was able to get in, which was not always a given, he was often not allowed to speak. And if he was allowed to speak, it was for a very limited time without any ability to speak to actually items that were on the agenda itself. So from that series of articles, the Brown Act was enacted to address those concerns. And what the Brown Act does is provide for the public to have access to governmental decisions at local agencies. And local agencies is a term of art that means really every kind of governmental agency in California, except those that are run by the state. So it does not apply to the state and department meetings and things like that from the state, but it does apply to counties, cities, joint powers agreement authorities, school districts, and the like. Any questions? One last point on this, it may be implicit, but when we are valuing transparency and the public's ability to be participating in their government, we are not saying that this is about efficiency. We're going to sacrifice some efficiency to achieve that transparency. So sometimes I get asked, why is that the requirement? Well, because that's what's necessary for transparency, even though it makes the process a bit more cumbersome at times. We can have the next slide. So like I said, it applies to local agencies. And because it applies to the Board of Supervisors, it applies to subsidiary boards of the Board of Supervisors like this body here. And we'll talk about your subcommittees as we go through. Next slide. The heart of the Brown Act is about meetings. And a meeting, as defined by the Brown Act, is any time a majority of the decision-making body is together, whether that be in person or virtually or electronically, and is discussing matters that might be of relevance or are of relevance to the jurisdiction of the body. How many members do we have on this committee?
With the full board, there are 15. Currently, there are 11.
Okay, so 6 of you make a quorum. I'll go ahead and assume that's right. 6 of you make a quorum. So anytime 6 of you are
Yes.
together and discussing matters that are related to public health, and that's pretty broad, right? You're having a meeting. Now, the question will be whether it's lawful or not, and we'll get to that in a moment. But again, it's two-prong analysis. Are there 6 of you or more? And are you discussing matters that are relevant to public health? The math is easy. The second prong is matters relevant. Now let's say things that are clearly not relevant to the work of this body. If 6 of you or more happen to find yourself at a kid's soccer game and you start talking about how your son, your grandson, your granddaughter are doing out there on the field, that is not a meeting. Because even though 6 of you might be together, you're not meeting the second prong, which is discussing matters of relevance to this body. But should you also be on that soccer pitch and then start talking about, gee, I hope everyone is vaccinated, why aren't they playing with masks? You're starting to veer into matters that are within the realm of or jurisdiction of this body, and you have created a meeting. Decide as we go along whether that's a legal meeting or not. Any questions? All right, and we can have the next slide. So the general rule is a majority of the board cannot discuss, deliberate, or take action privately about an issue that is on the board's agenda or could be on the board's agenda, no matter how the conversation occurs. So certainly my example of being on the soccer pitch is one way it could occur, but they can also occur by telephone, by email, by text, social media, an intermediary, or in a serial fashion from person to person through any of these mediums or in person. And then we'll talk about that more in a moment. Any questions?
Rick, I have a question. This is Libby. You just said one of the ways that a meeting can take place is through an intermediary. Can you elaborate on that a little bit?
Yeah, so thank you. That is a good question. The Board of Supervisors will routinely get briefed, and I assume this is true for the City Council and other elected bodies. They will get briefed by staff, briefed about here's an issue that's on the board's agenda or the City Council agenda next week. And that is perfectly permissible. But what is not permissible from the Brown Act is for that staff member to take the concerns of one member of, say, the city council that are raised during a briefing and then take that to the next member of the city council that they brief. That person then is acting as an intermediary, facilitating dialogue between the two members, and that's what's not permitted. Or well, it's not permitted in the sense that when you get to a majority of the board or a quorum, you've created a meeting. And the advice is, don't even start that process, because you can lead to creating a serial meeting using intermediaries or any of these other examples or mediums for communication. Libby, did that answer your question?
It does, and it feels like it opens a can of worms that you're probably going to get to, because it sounds like you could have, let's say, a subgroup meeting of 3 people one week and a subgroup meeting of, let's say, 3 different people, or 3 people next week where there's one comment in person. If they carry over the conversation, is that then considered a violation?
So Libby, you are stealing my next slides that are coming
Okay.
about, about serial meetings, but yes, we will get to that.
Okay, great, thanks.
So examples of meetings, and these could be lawful or unlawful, and we'll get to what distinguishes them, but examples of meetings, Liz, if you could hit the animation. Formal meetings like this one, collective briefings, retreats, site tours, and meal gatherings. Now, all of these examples could be lawful or they could be unlawful, depending on if the full panoply of rights that are afforded the public are under the Brown Act or afforded to the public. If we could have the next slide. Unlawful meetings. They're pre-meetings. In other words, let's say in the time of COVID, 6 of you logged on, 6 or more of you logged on prior to the start of the meeting. And you started discussing how things are going to go on the first action item. Who's going to vote how? That is an unlawful meeting. It's an unlawful meeting because you're clearly discussing matters that are relevant to the body. It's on the agenda, and there's a quorum of you. And why it's unlawful, well, we'll get to what some of the public's rights are, but the public didn't know that you were going to have this pre-meeting and therefore could not participate. Next slide, or next animation. Same thing. After the meeting's done, whether it's virtually or in person, 6 or more of you stay around and talk about this. And I've had this actually happen in a board that I work with, where there was some heartache over what had happened in the actual meeting, the formal meeting. And so a quorum of these members talked and then decided that they needed to bring it back for a future formal meeting. That was a problem because that was a quorum, again, talking about matters that were relevant to the body. And it is a meeting under the Brown Act, and it's unlawful because it did not afford the public all the rights that the Brown Act provides them, namely to be present, to hear the conversation, and to comment on it. Next slide, or next animation. Serial meetings, which we're going to have a whole slide on. Next slide. So Libby, this is, I think, what you're exactly talking about. The serial meetings are prohibited when they get to the quorum, when they get to, when they create a quorum, and again, they're talking about matters that are relevant to the body. Well, what is a serial meeting? There's some animation here, Liz. So it's that series of meetings, right? It could be, I mean, you have A, B, and C have this joint conversation, whether it's in person, on the phone, over social media, but it could also be in a serial fashion. We can have the next slide, where it's sequential. where A goes to B, B goes to C, C goes to D, so on. Or it could be a hub and spoke, which is A talks to all these people that are in that diagram there. And A takes maybe just A's opinion or A's and some of the others. But regardless, what A is doing in that bottom one is creating a meeting just in the same way it's happening in the sequential meeting. And the problem is for all of this is that if you are having a conversation with one member, on its face, you could say, well, this A is not a meeting because there's not a quorum of us. So it's okay even if we're talking about matters that are relevant to the body. But the problem is you can never know where you're at in a serial meeting. You could be totally acting as you think innocently and above board, but what happens is because you don't know who the person you're talking to has talked to, you might be B in a sequential meeting, or you might be D or E or F or so on. So for that reason, the advice that my office has given over many, many years now is don't have these conversations at all unless they're in a formal meeting. Any questions about that? Because I know I went through that quickly, and this is one where there is often concerns, except for with the PHAB. Great. So practice tips. I think I just went over that. I won't read that to you again, but I'll give you another chance for questions if there are any.
Rick, this is Libby again. My questions are about how this applies to our working committee, but you said that would be covered separately because I think a lot of this relates to how we meet.
Yeah, there's so subcommittees. I do have a separate slide for, and the Brown Act specifically recognizes that there's a need for subcommittees to meet sometimes very quickly, and I think the Brown Act accommodates that. So we'll discuss that in a moment. One of the questions though I get about this is, well, does that mean that if we're running late, I can't send an email? No, this again is about substantive conversations. Procedural emails or conversations about, hey, I'm gonna be late or absent. That's not what the Brown Act is concerned of. What it's concerned with is, again, the public not being able to be present when deliberations are going on. And so for that reason, the Brown Act says meetings cannot occur or are not lawful anyway, unless all the rights of the public are afforded to them. And I'm going to get to what those rights are in a moment. Next slide. So what is a permissible gathering? If you were to all find yourselves at an educational conference or social event, that fact is not a violation. As long, again, as you're not discussing business at the event, the business of the PHAB, that is, at the event. Next slide. And these are examples of lawful meetings like we're having today, a regular meeting that is at the time and place, assuming we were in person or on Zoom, that's established by bylaws. Special meetings that occur in conformance with the Brown Act and emergency meetings as well that occur in conformance with the Brown Act. The Brown Act's noticing requirements specifically. Next slide. So here they are, the rights of the public. If you could just go ahead and hit all the, yeah, thank you. We could go back. Okay, so the public has, and again, going back to those series of articles, what was not afforded to the author and the people and the communities that he wrote about, what was not afforded to them, and oftentimes was to receive notice that a meeting was going to occur. So the Brown Act requires notice of meetings to be posted so that the public can know exactly when the meeting is going to happen and what will be discussed at the meeting. The public has the right to receive the agenda and agenda materials. And what that means, of course, is that they get to know exactly what's going to be discussed, but also have the materials, the documents that staff has provided or the public maybe has sent in that speak to those agenda items. The public has a right to attend the meetings. And in the age of COVID, that of course means virtually, but when we go back to live meetings, the public has the right to attend those meetings. And that means that it's for all the public. So they have to be in publicly accessible places that are accessible to everyone. So a place that's in conformance with ADA requirements. When we get back to public meetings or in-person meetings, the public has a right to record what is going on. And so if somebody is sitting in an audience with their cell phone up, recording what's going on, that is perfectly within their rights. It only turns into a problem, something that may be a violation or not within their rights when they become disruptive. The public also has a right to comment on every item that's on the agenda and to make, and they should be a space on every agenda for off-agenda comments. And the reason for off-agenda is so that the public can say, hey, board or city council, you never talk about this. It's not on any agenda I see, but it's very important to me. And that way the public can put hopefully in front of their elected officials and also the bodies that advise them concerns that they might have. And then lastly on this, there cannot be any secret ballots. The public has an absolute right to know how each member votes on every action item. Any questions?
I had one for you, Rick. Steve Heath. I'm just curious, in the context of this, how do you deal with notice for an emergency meeting?
If there were an emergency meeting, the Brown Act has very specific requirements for that. It has to be as timely as possible. If, well, let me back up a step. Every body that has a website has to post their agenda on the website. And that includes the PHAB. So at a minimum, you'd have to have posting on the website. You'd have to have posting at the physical location where the meeting was going to occur. But as it's an emergency, so we're going to hold the meeting as required to meet the emergency. I don't know, did the PHAB ever do an emergency meeting?
Not that I can recall, but
Yeah.
Not that I know of in my tenure.
Yeah, that's not usually something that advisory bodies have to be concerned with. It's something that, as you can imagine, during times of disaster, during times of COVID, there are times where the elected officials, the governing body for a jurisdiction have to meet very quickly. And so the Brown Act does allow for that, but it has to meet certain criteria. And if it doesn't meet that criteria, we shouldn't be having an emergency meeting. Did that answer your question, Steve?
So that would mean that we have the obligation to post an agenda as soon as possible, but does not have to be at least 72 hours before.
No, it does not. In an emergency meeting, it's as soon as practical.
Yeah, just to let the rest of the board members know, that is an obligation we have, that we post our agenda at least 72 hours before the meeting.
Yeah. And I have some slide about the agenda and posting, but before we get there, I just want to say one thing about public comment. When you have an action item on the agenda, certainly public comment should come before there's a vote, right? Because if the comment comes after the vote, it's kind of meaningless for it to be effective. And if the item is on the agenda and it's somebody is discussing it, some member of the public is discussing it, it's appropriate, or at least allowable, for there to be back and forth between members of the body and the public. Again, it's not required, but it's not, it's allowable. And the reason for that from a Brown Act perspective is the public knew that was going to be discussed. Conversely, for off-agenda items, when the public comments, there should not be any back and forth between members of the body and the public. And the reason for that is because the only person that knew that comment was going to be made that day is that one member of the public. So anybody else interested in that would never have any notice that that was going to be discussed. So the only thing that should be said is, thank you for your comments. We'll consider this for future action if that's what's going to happen. But there should not be a dialogue back and forth with members of the public about off-agenda comments. Any questions about that?
Wow. That is not something I was aware of, or must have forgotten, because we're trying to make PHAB very accessible to the public and to public comment. And as such, within certain constraints, time being the one, our current policy is to allow public comment during the discussion of any items on the agenda. But we have in the past possibly violated this by having people make public comment on other issues that they want PHAB to be aware of. So under your current guidelines that you're presenting here, I would have to say just thank you very much, and we'll discuss it maybe at the next meeting. Is that correct?
That's correct.
Okay, I'll have to remember that one.
Again, it's about who's not there, right?
Yeah.
It's about the members of the public that might have been very concerned about, or might be very concerned about that issue, but had no idea it was going to be discussed.
Okay.
One last thing about public comment. There are some limitations to what the public comment is. It's supposed to be, first of all, relevant to the body. So people making public comment to the PHAB should be discussing issues that are related to public health. If they're not, there's two ways to handle it. One is to just let the comments go. The other is to ask them to please limit their comments to matters that are relevant. You also can impose reasonable time restrictions, 2 or 3 minutes, and that's really to allow a full range of public comments, not just the commentary to be taken over by 1 or 2 people. Any questions about public comment or anything else that is on this slide?
I have just one clarification. On our agenda, public comment is noted at the end of the meeting, but you mentioned that we must allow public comment before a vote. Is it necessary for me to put that on the agenda?
I think so.
Okay.
I think that it's without it, well, let me say it this way. Most people are not versed in the Brown Act, but they might have an interest in matters that you will be discussing. Without knowing it's on the agenda, they might think that they have to wait until the end, and they might not show up until 5 minutes before they think the meeting's going to be over. So not the only way, but the best way to alert the public, to make notice really the most effective, is to put on each and every action item, and well, actually every item on the agenda, public comment, because it not only tells the public that that's where they have the chance to comment about that item, it also tells whoever's running the meeting, which may or may not be you on a future meeting, Farla, that, hey, make sure you allow for public comment before we proceed to vote.
So that's an action item, but let's say, for instance, Deborah Payne's presentation on dental health, the Medi-Cal Dental Health Advisory or Dental Advisory Committee. Would that need a notice of public comment beforehand? I mean, that doesn't.
Yes,
It
the short
would.
answer is yes. The public gets to comment on things that are on the agenda.
Okay, and I
and-
could put that after the presentation, correct?
Right,
Okay,
yeah,
thank you.
you're welcome. We could have next slide, please. So notice requirements. Short to the point here, 72 hours before a regular meeting, it needs to be posted in all the places that I mentioned prior. Special meetings, 24 hours before. And what needs to be on the notice is a brief description of the item and you know, the order that they will be taken in. And as I mentioned, if there's a website for the local agency, it has to be posted on the website. Most entities now have websites, of course, but anyway, any questions?
Just the definition of special meetings.
Well, it would be a meeting that is not a regular meeting. So let's say you want to have a second meeting in the month. You would have to do it with at least 24 hours prior notice. You couldn't just do it with an hour's notice, like an emergency might require.
Okay, thank you.
So this is how you could have another meeting, even though you might not meet the definition of emergency. You could have a special meeting. It would just have to have that at minimum amount of notice. And of course, you could do it with much more notice as well, but it would have to have at least 24 hours notice prior. Next slide. And I think we discussed all this. You can see this slide. I'm not going to go over that in the interest of time. We'd have next slide. Could we have next slide as well? I think we discussed that. Committees. Really, for the Brown Act purposes, it boils down to one question. Is this a standing committee or is it an ad hoc committee? And the definition of a standing committee is anything that's going to have a continuing subject matter. So if you have the dental health advisory body or subcommittee, that's going to keep going on, I would assume, right? And because it has no end date, it is a continuing issue of concern, that's a standing committee. And because it's a standing committee for Brown Act purposes, it's a Brown Act body. And so every time that standing committee meets, it's got to go through and provide all of the measures that I've talked about up to this point. Conversely, an ad hoc committee is a committee that's formed for a limited time for a limited purpose. And if it's an ad hoc committee, it does not have to comply with the Brown Act. You could comply with the Brown Act, but you don't have to. And the reason for that is because it's a limited time. Time might be of the essence to get that committee to work. So in that regard, the Brown Act values efficiency over transparency, whereas it's usually the converse. Any questions about that? All right.
Hi, Rick. This is Libby again. Sorry. When you say limited time, are there parameters around that? How do we define that?
Well, I could imagine that, and I don't know if this is true or not, but I could imagine that in April of 2020 or May, a COVID subcommittee might have been formed. And it probably looked at that time like a ad hoc committee because we did not think COVID, at least I think most of us did not think we'd still be having COVID conversations 2 years on, almost 3 now. Maybe this is a bad example. Let's say, let me say what a standing committee would look like first. If you were to form a committee about health in the jails, right? The jail's going to be there for the foreseeable future. Health's going to be a concern. That's a standing committee. If you had a concern about a TB outbreak in the jail or anywhere else in the community, that would be a limited time and a limited focus. So, if you formed a committee to address that or to brief the body on that, that's an ad hoc committee because it has that limited time and focus. I don't have a hard and fast rule for you other than those examples. Certainly though, anytime you're thinking of forming a committee and you have that question, I can be available to advise on whether I think it falls into one or the other and why.
Rick, this is Steve Orcan. I believe that the standing committees are actually listed in the bylaws.
And you could do that. You could say here are our standing committees, but you could also form a committee that falls into the definition of a standing committee under Brown Act, even if it's not in your bylaws. Did that answer your question, Libby and Stephen?
Yes, thank you.
So the wise thing to do would be to set a time limit on a committee that you envision to be a ad hoc committee.
Yes, that is one way to handle it. To say that this committee is only going to be around for 6 months or 4 months, something like that. I think you start getting into much longer than that. It starts looking to a lot of people like a standing committee.
All right.
I believe that's, oh, yes, this would be the last one. So all of this means what if I violate it? If you violate it? Well, there are civil and criminal sanctions. The civil sanctions mean that if there is a violation, it could nullify, if there's a violation of the Brown Act, the actions that occurred in that meeting where the public's rights were not afforded, those actions might be nullified. If the public brings an action, it's usually a writ, and they succeed, which is to say they demonstrate that there was a violation or were violations of the Brown Act, they get a corrective action, i.e. don't do that, stop doing that, but they will also recover their attorney fees and costs. If there are knowing and willful violations of the Brown Act, that's each and every time is subject to criminal sanctions, namely they are misdemeanor violations of the government code. And with that, I believe I am done. Any questions about things I covered or things I did not? Great. Well, I appreciate your attention, and Farla knows how to contact me if some questions come up regarding the Brown Act or other matters. So thank you.
One last question.
Sure.
This issue of meeting virtually, and I know that we're allowed to do that because I believe an action by the governor suspending certain provisions of the Brown Act and the Bagley.
It was the governor originally, and then the legislature ratified.
Okay, is that something that will persist, that we will have the ability to, in the future, meet virtually after the pandemic emergency is over, or transition to a hybrid model? My concern is allowing greater public participation in the meetings.
So I think there's two components to that question. The first one about the members of the body being able to participate virtually whenever it is we're out of this pandemic. I don't know the answer to that. I mean, I think that there's certainly the last couple of years have opened, I think, everyone's eyes to the possibilities. But the Brown Act as it existed prior to this pandemic would not have allowed for that. In fact, the Brown Act did allow for people to participate remotely, but what it required was that, say, you, Farla, were going to call in from wherever. Well, you had to be in California, and you had to be in a place that was accessible to the public, and all of the rights that the public had in the actual physical meeting space, they had to have in the space that you were in. So you really couldn't do it from your hotel room. You certainly probably wouldn't want to do it from your house, because you'd have to open your house up and allow people to be able to comment from there. Places where I'd see people do that is I advise the Area 4 on Aging, and that is a multi-county body. And so there are members, Board of Supervisor members that are on that body in Sierra County and Alpine County. And so they might go to their board chambers and call in from there. And of course, their board chambers would allow for that. But you couldn't be doing it from your car in pre-COVID time. So what it will look like after COVID, I don't know. Now, the public, I don't think the Brown Act ever required the public or limited the public to only being in person. So I think even the Brown Act as it existed prior to COVID would have allowed for virtual participation. It's just that the infrastructure for that didn't exist, I think, for most entities prior to that. So I think that, if the pandemic were to lift next month and we had to go back to pre-COVID rules you could still allow the public to participate via Zoom.
Great, thank you so much. And thank you for the entire presentation. I keep learning every time more about it. And I'm sure the board appreciates being able to contact you with questions if they have any.
All right, thank you all.
Thank you. Okay. So now we turn to our working committee update. And I'll hope that Libby has a bit of information about what the committee's doing now.
Yeah, I'm happy to give an update. It will be very brief and not too different from December. I think things really slowed down for the end of the year, and we have not yet had a chance to reconvene in our subgroups. But you'll remember from the December meeting that we were talking about kind of taking some of the emergent themes in our work area and dividing them into even smaller groups so that our working committee of 6, 7, 8 people can divide into 3 focus areas. Steve is taking the lead on kind of our networks and partnerships work and has already done quite a bit and made some great connections for us. And then we need to figure out next steps for the one that will be focused on alternatives to incarceration, as well as the work stream that will be focused on data, reporting, dashboards, etc. So not too much new there, but happy to answer questions if there are any, or Phil, if you're free or want to add anything, feel free.
Nothing much to add on my end. Thanks, Libby.
Okay, thank you so much to the entire committee who work very hard on this and are making great progress. I just want to mention one other thing. Well, let me ask for public comment first. Any of the public? Okay. No comments from the public?
Hi, Farla. I have a couple of comments. I wanted to follow up on some of the discussions we've had on the COVID-19 data for the Sheriff's Office as well as the jail health services.
Mm-hmm.
So I see that Sandy Damiano is on the call as well. I'm wondering if Public Health has taken any initiatives to push the Sheriff's Office to be more transparent on compliance with the July 26th health order.
Sandy's muted. Let's give her a minute. There we go.
So I'm not quite sure what the question means. If you could restate that.
Yeah, sure, Sandy. So I think we talked in the past about the July 26th health order that applies to the sheriff's office, as well as the August 19th health order, which mandates vaccinations for all sheriff's office employees. So I'm wondering if the public health department is taking any initiatives to collect data on compliance with both of those health orders, because I would imagine that the public health department would be interested in knowing how many staff members are vaccinated, since that's a very significant part of how COVID can or cannot spread in the facilities.
What I can report on is that I provide data weekly to public health and do meet with Dr. Kassiri and the public health staff every other week, sometimes weekly if we're in an outbreak mode. So they get all of my data on vaccinations and so forth.
And this is for jail health services, right?
Jail health.
Right, but there's nothing on the sheriff's office, as in jail staff, so staff members working in custody.
Yeah, you really have to go to the sheriff's office for that report on jail staff vaccinations for the sheriff's department.
So here's my question. I think we've talked about this, and the PRA process is not successful. We're not getting the response that we're asking for. So I'm wondering why or why not have the public health department put in a request or a health order itself to say the sheriff needs to submit monthly reports just talking about compliance with both of these health orders. Because I would imagine that as a public health body, you would be interested in having this data because that informs your public health decisions.
Okay, so I'm not with the health department. I work for health services. I saw their initial vaccination report, which I think they were at about 60% vaccinated, but I don't get all ongoing data for that. So you'd have to speak to probably the health, public health.
Okay, and Farla, following up from our conversation that we had with Philip, is there any movement that you both have been able to make in pushing this forward?
I have not made any movement on it or inquiries. It is on a to-do list in terms of the in relation to the working committee, but I'm willing to hear any other progress from them and discuss next moves. And I apologize for the delay in this. I know that we talked about this a while ago.
Yeah, it's been over 2 months, and as you know, there have been several severe outbreaks since then. There were 2 deaths that were reported. So I think this is a very important piece of information. And so what is the timeline that you have in mind now for when you would speak to the public health department or the PHAB on the whole would try to push for more data transparency?
I think that we can have a conversation about the next steps. And perhaps we can, part of the working committee responsible for this can meet with you again and go over exactly what we are able and willing to do about this, maybe this week. Would that be something satisfactory to you?
Yeah, this week sounds good.
Okay, so we'll be in touch. I'm sure Phil and the rest of the committee responsible will send out something, and we can meet about it. It's an important issue.
Okay, thank you.
Thank you. Any other comments, questions? No, we're about out of time. Thank you very much for participation in the first meeting of the year. And there's a comment in the chat that was in regards to the op-ed piece that Dr. Cassirier submitted, and it was published in the SACB. And I think I will circulate that to the members. It's a very excellent piece.
Carla, can I ask a quick question? Hi, thanks for the meeting. I'm just, given that I'm new to this board and that we're back in yet another public health crisis with COVID, I'm just wondering, does this board just wait till next month to meet, or do you have a interim COVID discussion or update? The new guidance is out, and I think there's mass confusion everywhere, and things are changing quickly with the new guidance and things that are coming from Washington and how that's impacting our communities, you know, economically, socially, and health-wise. So that's my question, is that if we don't talk about it here, is there another place where it's discussed, or do we just wait till next month and hands off?
Well, as you heard from Rick, it's we're limited about how we discuss this. We're not permitted to have meetings. We can schedule a special meeting. Unfortunately, we didn't have an update from public health on the current situation. If you would like to, we usually have an update from public health that's quite extensive. But in this case, we didn't. So unless there's an urgent need, we wouldn't schedule a special meeting. I can certainly see if we can get a written update from public health and then circulate it. I'm wondering if you have a specific question, you could possibly send it to me and I could pass it on to public health that they could include it in their update. Also, I want to just note that there is this wonderful forum that two of our past members coordinated, that the public health, the establishment of this forum that public health has every 2 weeks. It's a great opportunity for the community to ask questions of the experts. And so that's another option for people to understand how the county is responding. And I can send out a link to that as well to the committee. But are you suggesting we schedule a special meeting?
I'm new to the group, so I guess I would ask others how they feel, just given that, again, there's new guidance that has come out that's impacting every sector of our society in Sacramento County. And number two, that we anticipate having even more changes to guidance within the next week and so forth. So personally, I would say yes, I am, but I, again, am new. So I would also like to hear from colleagues here if that is something that people feel would be useful, given the various places that people interplay and influence in this committee.
Are there any comments? We try and limit the special meetings that we hold.
Okay.
But perhaps the update from public health might help. And if you have a specific question that you'd like them to answer, I can pass that on and then we can discuss this further. Maybe.
Yeah, no, I was thinking more of the group. I have lots of avenues to access information from public health, but thank you. So I will again defer to the group, and I want to be respectful of time. I see now that we're 4 minutes over. So if nobody else feels that there's an urgent issue or kind of need to discuss what's happening, that's
okay.
Fine.
Thank you very much.
Thanks.
And thank everybody for your participation, and we will see each other next month.